Good morning. Anybody can hear me? Everybody can hear me? Yeah? Can you hear me in the back? Very good. So, wasn't Lori amazing? It was, she, on top of everything, she has really good plans to do all of this. Even we in Colorado usually don't do those kind of things. Well, she did not talk about pain though. And I'm sure there was a lot of pain going on in her body while she was doing this. Well, we will talk about one of my patients, person with Parkinson's, and his pain, and elaborate on that. So here, we should have, here we go. 72-year-old male who is alone at home was picking up his newspapers and slipped on the wet leaves at home and hit his left hip. His neighbor saw him and called 911 because he couldn't get up. And he ended up in the emergency room, did not have fracture. In Parkinson's disease, probably 4 times more people get fractured than in a general population. So he could not go home. He was in so much pain, he could not go home to take care of himself. He went to the rehab, to the skilled nursing facility, was started in the emergency room on oxycodone, and was too sleepy when he came to that building. He was not able to do any rehab, so the oxycodone was stopped, and then he was in too much pain. And then when I talked to him, he was saying, well, I always had some pain in that left hip, and I have all kinds of pains, okay? Well, we don't know much more about those pains, but let's start with what kind of pains he could have.
These photos indicated.
Here we go. So, pain is actually the 4th most disabling symptom in Parkinson's disease after slowness, tremor, and stiffness or rigidity. We distinguish the acute and chronic. You know, he fell, he hit his left hip. He hit his left hip and had this acute pain. But he also had some kind of chronic long-term pain which we should be addressing. And we were not really sure if his pain was related to the timing of his Parkinson's medication. What we do know is that in general population, there is up to 40% of people have chronic pain. Now we will be talking about the chronic pain. And in Parkinson's disease, the number is double, okay? People with Parkinson's disease have more pain than people without it. So we will be talking about musculoskeletal pain. That's the pain he had after he fell. We will be talking about neuropathic pain. That's the pain which is people describe it as numbness, tingling, pins, needles, or it can go along the nerve like the sciatica pain. We will mention the dystonia pain, which is basically a muscle cramp, which is a painful contraction of one muscle or several muscles, and it can last for seconds or hours, and the muscle can be really sore after that. Then we have the pain from restlessness. It's not too common, but it usually affects lower limbs, and it can be relieved by walking. It's usually connected to the typical antipsychotics, and it's not too common. And then there's this primary or central pain in Parkinson's disease, which is, painful, burning, stabbing, gnawing, pain which is not really attached to certain part of the body, and we don't know much about that pain, and we don't know what to do about it either. Oh, now it hurts. So let's talk about osteoarthritis, because that's the most common pain in the general population, the chronic pain. But again, people with Parkinson's disease do have it more often. And why is that? Because there is the lack of the spontaneous movement. There is the stiffness, the rigidity. There is the abnormal posture, pulling on the ligaments, pulling on the muscles different way than usually. And it can be a first presentation of Parkinson's disease. When the researchers looked at a group of people, the shoulder pain actually was often presenting syndrome of the Parkinson's disease. The fact that the person did not move that arm and had some arthritis, those people ended up having shoulder surgeries. Similar with the carpal tunnel syndrome. That's when you have pain in your hand, when the ligament is pushing on the nerve in your wrist. So those could be presenting symptoms of Parkinson's disease. So how do we deal with the osteoarthritic pain, the arthritis, the usual arthritis pain? What we geriatricians recommend, internal medicine doctors, is Tylenol. And that's what I would like you to start with. If you have this arthritic pain in the morning, you are stiff, you cannot get up out of the bed, and it's your back, your typical chronic arthritic pain, then start with the Tylenol. We call it also acetaminophen or APAP. The best is to do maximum dose 3 times a day scheduled if you cannot really move because of this pain. And really schedule it 3 times a day, and don't use any other Tylenol in any other products. Because it could be the cold medicines, it could be Tylenol PM, which you take, which you should not take at all, ever. So that's your first step if you want to take pills. Okay. Now we have so-called NSAIDs, non-steroidal anti-inflammatory drugs, like ibuprofen, naproxen, COX-2 inhibitors like celecoxib. Those medications do have effect on your kidneys. They increase blood pressure. They can cause heart failure. They interfere with clotting. So there can be bleeding as a complication of this medication. So generally, we don't recommend it as a chronic medication, something you would take over weeks and months. If you have a gout attack, it's an excellent medication, which you know it will work right away, and it will work for, it will just give you a relief, and you should use it for a few days, 3 days, 5 days, but no longer. So some people with arthritis tell you, I can't live without that. But you have to be aware what kind of complications you can expect if you take this medication on a regular basis. I am a big promoter of topical medicines, meaning creams, gels. They all do have evidence that they are effective. So capsaicin, arnica, menthol, camphor, all those icy hot creams, or lidocaine gels the doctor might give you, they all work, and that's actually something you might start with if you don't want to take pills. It does not last for hours, but or the whole day. You might do it several times a day, but it is extremely effective without side effects. The non-steroidals can be also in the clinics. They are expensive, so I generally don't prescribe them because why use it? They are not that much more effective than the others. And don't forget to moisturize. In Colorado, you know, the itching, the discomfort can be just simply because your skin is dry, okay? Well, opiates. We do have opiates as a strong medications which have to be prescribed by a physician. Tramadol, generally we don't recommend in elderly population. You need to decrease, decrease the dosing in that population. We do have medications like hydrocodone. We do have medications like oxycodone. Those usually come with they usually come with Tylenol. So again, if you want to take your regular Tylenol, you should just take the simple oxycodone, not the Percocet, which does have Tylenol. Same thing, hydrocodone. The first number is showing how many milligrams of hydrocodone is there. The second number is the milligrams of the Tylenol, of the acetaminophen. Then we have hydromorphone. We usually start with the diluted 1 milligram. We do have morphine, which has the advantage that it is in a solution, and when people have problems with dysphagia, we can actually put the drops under the tongue and relieve the pain, and that's really important in the advanced and end-stage Parkinson's disease. And you probably did not hear about methadone as a pain medication, but when I am using it is when there is a chronic pain and I need really tiny amount of an opiate for the person, then it's in a liquid and it can be really titrated to a minimal amount which I cannot achieve with all the other medications. All those medications most of them can be long-acting for chronic pain. They can be in patches. Most commonly it's fentanyl, which can be used only if you have some body fat because it absorbs through the fat. And I did not mention lidoderm patches, which people use. I would just use the cream. It's expensive and not any more effective than the lidocaine creams. And always think about constipation. If you start to use opiates, you should be on scheduled laxatives. If you were already using laxatives because you have Parkinson's disease, then you need to increase the dose because it's slowing down the bowels and the constipation will get worse. There is many other modalities. So I want that neighbor who found the person with Parkinson's disease, or John, put some ice while they are waiting for the ambulance because the ice will slow down the damage, slow down all the mediators of the damage. In the chronic pain, you might use heat. In the nursing home facilities, they can use machines for a deep heat. Massage will always be beneficial for chronic pain. And there are things which I forgot to bring. It's there is like a taping. You might see athletes with like taped shoulders. Those actually help, but the therapist has to be trained. So there are options which you might not be aware of. So ask around. talk to people, talk to me. Rigidity is a different type of pain, and there you need to talk to your physician who is managing your Parkinson's disease medications. Neuropathic pain, we described it. Be aware. If you get shingles, you can get post-herpetic neuropathic pain, meaning severe pain in the area where you had your shingles. So I encourage you to get vaccinated if you are in the proper age group, because even if you get shingles, the pain, the disease itself will have a much milder course. We treat it with different medications, but there is not much success. Those medications have side effects, and for example, gabapentin, which we always use for many years, we found out 50% respond to it and 50% do not. So that's not really such effective medication. Dysphonia in Parkinson's disease, it is surprisingly common, can be a first presentation. It's more in the younger population, can be on or during on period or off period when you don't, when you run out of your medications, that's easier to treat. The on period when you have your medications on, that's very more difficult. And again, that has to be addressed by the movement disorder specialists. And just think about all the other issues which can be a problem and cause the pain, like swelling, use the pressure stockings. Take care of your mouth. You know, if you have pain in your mouth, you don't eat as much and you lose weight. Take care of your dentition. Rule out depression. And when you are not sure what's happening, talk to your doctor, talk to your internist, because there might be something else going on, like renal failure, and you are aching all over and you don't know why. This topic was discussed within this group. Generally, there is no benefit for pain control in Parkinson's disease. It has side effects, and you know those are symptoms of Parkinson's, so you might worsen your symptoms with marijuana. So regarding the pain, there is no evidence that there is beneficial. Enjoying pets truly helps with pain control. And with that, I will take questions. Do we have the microphone?
My name is Regina. I was wondering, with the tramadol, why not? Why don't you prescribe that? Because I've been on it for a couple of years.
It is an effective medication. It does decrease the seizure threshold for people who have a history of seizures, and we do need to decrease the dosing in SUH, but you are not in that age group, so we do use it. I actually do use it pretty common, but it's something to discuss with your physician.
My name is Rich, and I'm just wondering if you could talk a little bit about specific kinds of exercise and specific kinds of pain that you mentioned.
So I think there will be the whole session about exercise today. I did not mention it therefore as a part of the pain control, but it definitely should be discussed. Specific exercises, for the lower back, so I'm not a therapist, but I do have problems with lower back. And I would say any exercise which starts with warming up, stretching, and then just flexing, extending,
strengthening up your abdominal muscles. With the sit-ups, I don't think we can do 500 sit-ups like Lori did, but if you have access to the machines, you definitely can strengthen up your trapezius and the lower back muscles. So I don't think you need any specific exercises. You just need to exercise, and you need to exercise a lot. I for my lower back pain, don't take any medications. If I exercise 3 times a week intensively, then I don't have any pain.
What's the relationship between weakness in your muscles and pain that comes from your muscles? For example, my thighs always, all right, and that's a huge muscle. So a lot of the medication that you talked about, I take it. I've got a number of things that you talked about. But my doctor doesn't believe, my neurologist doesn't believe there's a relationship between weakness, pain, and muscles.
There is definitely a relationship between weakness and pain. I see that every time I admit people who don't exercise and come to the rehab. They actually, to the point that people might be shaking because they are weak, but so there is definitely the relationship. The only answer from my point of view is to exercise those muscles. Make sure that you stretch them. Make sure that the interval exercises are the best ones. When you do 1 minute or 2 minutes, then have a break. There are different intervals for that. So the interval exercises are probably the most effective. But again, I'm not the therapist. I'm into the medicine doc, so that's more from my experience.
I'm going to talk about exercise too, but from a slightly different perspective. It's really a challenge for me knowing that, so I have from my physician a prescription to exercise, and I have much more pain when I exercise. Like my pain, if I don't exercise, my pain exists but is not exacerbated, but virtually every exercise that I've attempted to do for 7 years makes the pain worse. And so it's a real challenge for me to do this one neuroprotective activity and then have the pain. I don't take anything for pain. So my question partly is, would you recommend that I do? In general, I know you're not my physician.
Do you have the pain increase after the exercise?
Yes. I usually tell whoever I'm working with that I won't know that it hurts until tomorrow.
Okay, comment on that one, your experience?
This is Dr. Drew, who is the movement disorder specialist.
So the first thing to look at is what could be the potential cause of your pain. And neurologist needs to evaluate that.
Can't hear you, sir.
So the first question to do would be to look at and evaluate what is the cause of your pain. And a neurologist is probably best to be able to look at that and make sure there's not something else going on in addition to Parkinson's disease. The second thing is there is an entity called delayed onset muscle soreness, but typically that occurs 1 to 3 days thereafter the exercise routine. Stretching is often a recommendation to be done before and after exercise, adequate fluid intake, and then you can try to take an analgesic such as Tylenol, as you heard about, or ibuprofen as a prophylactic treatment after exercise. I myself actually do take ibuprofen right when I'm starting to exercise because I do actually have some pain afterwards.
You?
Yeah,
there any evidence that Parkinson's disease is actually deteriorates the muscle? In other words, Parkinson's causes the muscles to deteriorate.
I don't think so. I think it's because you don't use those muscles. So I think that's, that's why you get weaker. But I think that the dopaminergic problems are not causing the decrease in the muscle mass.
We have time for one more question. For someone. Okay. But I'm sure Dr.
Sure.
will talk to you after.
I'm a physician with PD, and I also direct the program up in Fort Collins for a support program. And as far as I'm concerned, I exercise a great deal, but I take aspirin immediately afterwards with lots of water, and then fortunately, I have a hot tub. And if you don't have a hot tub, a big tub, because it's amazing. In fact, I climbed Mount Bierstadt a month ago, and I came home and soaked in the tub, and the next day I was tired, but I wasn't sore. And the other strong recommendation I have for people is yoga. I can't tell you how wonderful I think yoga is for what it does for us.
And I think that comes a lot to the stretching of the muscles, and I totally agree with the hot tub, the heat, which, as we mentioned, and the hot tub is ideal for that because it heats up the whole body. So with that, we will end, and if you have further questions, I'll be available after the session.